And the DVR is going. Hi, welcome to Nutritional Medicine by Lab Analysis. I'm Dr. Cyrus Thomas. I have been a physician here in the U.S. for 33 years, practicing chiropractic. I do a lot of nutrition and lab work. We're going to be talking about things in detail tonight. Our show is about anxiety and poor concentration. Let's go ahead and get started. We're going to be using, for most of the analysis that we do, blood, urine, and hair analysis, as well as a questionnaire and talking to the patient and doing a physical exam, listening to their heart, taking their blood pressure and pulse, and doing everything that is normally done in a physical exam. Smart medicine is usually nutritional medicines because nutrition is a form of medicine different than pharmaceutical medicine, but still using molecules to treat the person. We'll talk about in detail the difference between the two. They do work, nutritional medicines, extremely well. They've been around for about 80 years. We're going to be using medical analysis in testing the blood, the hair, the urine, the stool, but we're going to be treating with nutrition instead of with pharmaceuticals. In the last 30 years, there has been an explosion in nutritional knowledge. Nutraceuticals are medicines, and they are complex molecules. The only difference is that they are found in nature, and so they cannot be patented for profit. Nutraceuticals are medicines. They are complex molecules. The only difference is that they are found in nature and so cannot be patented for profit. An interesting point there. Don't stop your medications. No one needs to be told to stop their drugs or the treatment that they are on. Regular pharmacy medicines are called pharmaceuticals, whereas nutritional pills are called nutraceuticals. They're both complex molecules. Let's read this together. Pharmaceuticals give support, but once nutraceuticals begin to affect a cure, then the blood and hair tests will show that it is safe to reduce the pharmaceuticals. You will feel the difference, and you and your pharmaceutical prescriber will want to reduce your intake of pharmaceuticals due to their side effects. We're always wanting to reduce pharmaceuticals because of their side effects, or to eliminate a pharmaceutical completely in favor of a nutritional substance, because a nutritional substance is curative in nature. It is not designed to make the symptom appear to go away. Oftentimes people mistake that in their bodies, when they see a symptom go away, it means that the pharmaceutical has come into place and is giving so much support there that if they remove the pharmaceutical, they would fall apart. In reality, the pharmaceutical is keeping the symptom away in sort of a tricky way. And once we can get true support to come in nutritionally, then we can take the pharmaceutical away and all will be well, and we'll actually have cure of the condition. Now, this is the blood test that we do, which includes 52 different elements. We're looking at the thyroid, the kidney, the liver function. We're looking at white blood cell count, red blood cell count. We're looking at minerals in the body, how well a bile is being circulated, a whole array of things. And you'll notice that when this person first came in, these were their results. And up at the top, we can see on a close-up here that blue is critical, red is high risk, and yellow is a warning. So when they came in, they had some yellow, reds, and blues. And when they retested some 6 months later, One of the reds had turned to a yellow. Two of the blues had gone to red. This is actually an excellent result within 6 months' time. We like people to not be just between here and here, like laboratories tell us are healthy, like most physicians will say that you are healthy. Physicians who do nutrition have a much stricter range, and they use this narrow range in here to say this is healthy, but if you're in the gray here or here, you're probably not feeling so good, and yet people are telling you that everything is fine. In reality, it's not fine, and we need to work towards getting you here. This is a graphic design of the hair follicle, and you can see that in the bottom of it there is an artery and a vein that send a little venule into the follicle, which actually creates the shaft of the hair. Yeah, that's a nice close-up there. And in the hair follicle, we find trace amounts of chemicals found in the hair follicle. It illustrates the toxins that need to be removed from the body. The body is actually using the hair to get rid of minerals. So sometimes when we start a person on oral chelating agents, those are natural pills that a person can take orally that actually go in and attach to heavy metals. We'll take a look at what those are in a moment, and help you to urinate them out of the body. Oftentimes when we start that process, the body will begin to dump heavy metals into the blood from the cells. The hair follicle picks up that all of these heavy metals are in the blood, and it takes them and puts them into the hair shaft. So the actual amounts of heavy metals will go up in the hair sometimes, which is an indicator that the process of getting rid of these heavy metals is taking place properly. This is the actual test result. The top half are the heavy metals that we want to be on the 0 level, back at this line. No amount of these heavy metals is acceptable, and we want all of these black lines to come back to 0. The other half of the test from the hair analysis are actually good metals and minerals, and those have a healthy range in the middle. They should not be too low, they should not be too high. By using this test, we can find out how to affect that, and oftentimes find what problems a person is having, and know what to do to make the correction. There is absolutely no risk in this testing. Unlike X-rays, which we're hearing more and more that X-rays are involved in production of cancer. A mammogram is another type of X-ray. A CAT scan can be the equivalent of 500 chest X-rays. Exploratory surgery has the risk of you not coming out of surgery, and also of nerves being cut in surgery. Needle biopsy has the risk of spreading cancer. If you go to Google and put in needle biopsy danger, you'll see the medical studies that have been done to indicate that this should not be done anymore. And to test a person's state of health by actually prescribing medicines to them to see if it will make a change. This is a risky thing to do. The method that we're talking about doing here has none of these risks. The key points that are good about this method of using blood analysis, hair analysis, urine analysis, stool analysis, is that we're doing many more tests, 52 in the blood alone, and we can also include cancer markers. Now, we like to use cancer markers because this is a good way to find out if cancer is beginning to develop. It doesn't say you have cancer. I mean, in this country, we either say you have it or you don't have it, but in reality, it's a slow buildup until finally there's a tumor. And then when you have a tumor, we say you have cancer. But in reality, it was a slow buildup towards it. These cancer markers can tell us if you are building up slowly towards the number of cancer cells where eventually they begin to accumulate into a tumor. We create a healthy range, that narrow range where you should be. Our lab results are compared, your lab results are compared with the results of other people's and also with how well they did on nutrients to correct their lab results. All of that is included in the report, that 15-page report that we create on your results. And when we do follow-up studies, they get listed side by side in parallel so that we can see immediately what has improved and what still needs work. The hair also contains minerals and essential elements like copper, chromium, iodine, sulfur, and iron, 22 essential elements. And those were the ones that we were saying should be in balance, neither too little nor too much of them. And the hair test tests for 17 heavy metals like arsenic, lead, mercury, tin, and aluminum. A blood test alone will miss this. When you only do a blood test on a person, you have no idea about the heavy metal content in the person's body. And those heavy metals interfere with chemical pathways that need to take place. And when they can't take place, you can't create the vitamins, enzymes, can't use amino acids properly. It plays havoc with human physiology. If you were to design a better system than the one I'm telling you about here, could you actually design a better one? So far, I don't think so. This is state-of-the-art medicine. I believe most of medicine will be like this in 30 to 60 years from now. And the results speak for themselves. You are welcome to visit my website and read the case examples. My website for plenty of information and to watch older shows of these. We've done shows on irritable bowel syndrome, several shows on cancer, cardiovascular. We've done thyroid shows. Go watch those at the website. Alternative Integrative Medicines with an S, .info. AlternativeIntegrativeMedicines.info. Write that down. I think you'll enjoy that. Tonight's topic, anxiety and poor concentration. Both mental and emotional issues. Anxiety and poor concentration originates in the brain. Testing for brain chemistry imbalance is where we start. We look at the level of heavy metals in the body because the heavy metals interfere with brain chemistry. We also look at free radicals in the body. Free radicals are molecules that want an electron, and so they create havoc in joining with molecules that they shouldn't join with. They also tend to cover the surface of cells and cover the receptor sites that those cells need to get nutrients into the cell. And we look at a person's mineral balance, of course. This is a scientific approach. It is holistic and naturopathic in approach to the treatment of anxiety and poor concentration. It uses the best that modern medical evaluation has to offer, which is all the testing, and